Well, hi everyone. Welcome to another video where we dive into the details of Purdue Pharmacy. Today I'm with a couple of our students, Fatima Khan and Moses Martinez. They are both students in the Purdue Doctor of Pharmacy program, and we're going to discuss the future of pharmacy. And so if you watched any of these videos, you know typically I'm the one asking the questions, and today we're going to flip it around, and actually the students are going to ask me a few questions. And so welcome to both of you. Thanks for being with us. And I look forward to your questions, so I'm going to just hand it over to you both.
Thank you, Dean Barker. Let's get right into it. Based on the progression made here at Purdue and by our peers, what are a few key expectations for the future of pharmacy?
Well, as we look to the future of pharmacy here at Purdue and really beyond, there is one thing that we see that we think is really, really clear, and that is most people see pharmacy from the community pharmacy side, which is perfectly normal and expected. And we're going to see a much bigger shift away from being distribution of product, which is what most people think about when pharmacy, to providers of patient care and direct patient care. And there's lots of great examples of that. But I think one of the things we see, for example, is community pharmacists now really embracing point of care testing, for example. And so there'll be a real opportunity, for example, if someone thinks that they have the flu or strep throat, instead of having to go to urgent care for that quick test, they'll be able to do that in the community pharmacy. On protocol, the pharmacist will be able to administer the test, and then depending on the results, if it's positive, dispense the appropriate antiviral or antibiotics to the patient, and maybe that's an in and out experience in less than 30 minutes. And it's really transformative, I think, for delivery of care. So it's just one small example of, I think, the shift, but there is no question that there will be a much greater emphasis on provision of care. And also, I think, opening up the breadth of opportunities that are out there for pharmacists, whether it be in community practice, hospital practice, industry, nuclear pharmacy. Our graduates are seeing great opportunities across many different areas.
What are some barriers to the growth and expansion of pharmacy practice?
Well, the growth and expansion of pharmacy practice really hinges first on what happens in each individual state. The reality is that in the United States there are 50 different models for pharmacy practice. Each state regulates those differently, the state legislatures and the state boards of pharmacy. So it starts with us being great advocates for our profession. So we have to advocate for expansion of scope of practice to allow you, our graduates, to be able to practice at the highest level, to practice at the top of your license, if you will, and really do the things that we've trained you to do. So one of the things that we're training you to do is to be advocates for the profession, and so you need to be able to go out and lead and advocate for change in the profession. The other barrier probably starts with each of us, that we have to get over our own fears about tackling these things and go out and be those advocates, and also embrace new opportunities in the profession.
Dean Barker, Purdue Pharmacy consistently ranks in the top 10 of pharmacy schools. What would you say Purdue Pharmacy is doing to continue the leadership in these advancements? And how will this change the way the college prepares future pharmacists?
Well, so there's sort of two parts to your question. What are we doing to keep in the top 10 and be a leading program, and how does that mean we're going to have to change how we teach? And so we've just completed a new strategic plan. We're really excited about some of the new initiatives that we're laying out, but we really have tried to be forward thinking, and we had really alumni leaders help us formulate this strategic plan. But there's some key areas that we're going to focus on. One, personalized medicine and precision health. It's going to be a major emphasis going forward, whether it be pharmacogenomics or other aspects of patients that we need to embrace. Pharmaceutical biotechnology is exploding, and there will be wonderful new opportunities for pharmacists in the pharmaceutical biotech space. And so we want to be sure that our graduates are ready to do those things. So we're beginning some initiatives in those areas. Data science, artificial intelligence, the explosion in technology is going to revolutionize healthcare within the decade, I believe. And so as a campus, Purdue is embracing data science, so we're going to find a way to be sure that our pharmacy graduates are ready to be in that space as well. In terms of training or preparing the next generation of students and how we teach, it starts with our facilities. And the reality is that the pharmacy building here at Purdue was designed in 1965. And how we trained pharmacists 50 years ago is very different than it is today. And so you all know, you sit in the classrooms here, and many of them, you're all in rows, and we want to get you in circles and give you opportunities to do hands-on kinds of activities, to embrace new educational technologies like augmented reality and virtual reality for simulations, to prepare you so that when you go into practice settings that you are ready to embrace those opportunities.
Thank you. What are some skills that you would expect a student pharmacist here at Purdue to begin developing that would help cultivate and progress them into becoming a future pharmacy leader?
Well, the key to your question was what we're doing to help you be leaders, right? And we hope that, first, we know that we're giving you the knowledge to be a successful pharmacist. But beyond that, beyond the classroom, what is that mindset? What are those habits that we hope that we're instilling in you that will allow you to be leaders wherever you are in the profession of pharmacy? And there's three things that I think we try to do. One, it's encourage you to accept new challenges, to be fearless and not be afraid to accept new challenges, so that when your boss says, I need someone to take on this project, you're the one in the room raising your hand and saying, yeah, I want to do that, and you're going to do it, and you're going to do a great job. Secondly, that you'll adapt, that you'll be willing to adapt to new technologies, changes in the workplace. Healthcare is going to change dramatically over the next 10 or 20 years, certainly your careers, and you're going to have to be adaptable. And those that adapt will be very, very valuable to their organizations. And lastly, it's about associating internal to your organization and outside your organization, associating with your team on a healthcare team, and also associating with the profession of pharmacy, your state and local professional associations, national associations, again, to be advocates for the profession.
And with the ever-rising importance of diversity and inclusion, what are some ways that Purdue Pharmacy distinguishes itself in excelling in this specific area?
Well, there is no question, Moses, that we have a very, very strong commitment here in our college to diversity and inclusion. It is one of our core values. And to reflect that, we have embedded in our curriculum, and our faculty have approved what we call an intercultural curriculum. And it is embedded throughout the curriculum. There are specific activities, measurements, approaches that we're taking to help you as our students, and frankly, we as faculty, to grow, because that's part of what you want to do while you're here in the College of Pharmacy. So our hope is that you're going to develop a new appreciation for different cultures, and that allows you to approach people with empathy and respect. It's really important when you think about being very effective healthcare providers that you have those qualities, and so we believe this is really, really important. But we hope it reflects our overall community and the culture here and the climate here within the college, as well as a welcoming and supportive community. We've also are having conversations around what we call cultural intelligence. It's beginning to emerge in much of the education literature. We've talked about IQ, people know about intelligence in IQ form, and we've talked about EQ, emotional intelligence, over the last couple of decades, and now we're talking about cultural intelligence and measures of cultural intelligence. Again, it's about where we are today and where we hope to be, and we hope that that will begin to change all of us as we have a climate that is supportive of everyone that's here. Well, thank you both, Fatima and Moses, for your questions and for being with us today. These were really, really great questions. I appreciate your leadership within the college, and I look forward to seeing where your careers go as alumni of the college here in a few years. If you out there have any questions about Purdue College of Pharmacy, don't hesitate to reach out to us. You can find us on social media, and you can also email us at pharmacy-oss@purdue.edu. That's pharmacy-oss@purdue.edu. Thanks for joining us.